name is Inga Houston. I am President CEO of the Dublin Chamber of Commerce. And today I appreciate you joining us for a presentation by Stanford Care Valley Care on returning to work safely after COVID or during COVID. But first, I'd like to recognize my board members that are in attendance. We have Julia Dozier with Chabot Las Positas Community College, and Sue Stevenson with Dublin San Ramon Services District. I always want to say DSRSD, but not everybody knows what that means. So anyway, welcome. Thank you for joining us today. Oh, I changed my screen. I had it all dialed up. Okay, we have two occupational health services personnel from Stanford Valley Care. We have Dr. Chan. He is medical director of the occupational health services at Stanford Healthcare Valley Care. He is board certified in occupational medicine and brings more than 25 years of experience in the field to our clinic, or to Stanford's clinic. Dr. Chan has a wide range of experience that includes both clinical and administrative duties, leadership duties. His expertise includes occupational medicine and workman's comp, case management, injury care, disability management, medical case management, and utilization review, along with employee health and wellness. Also, please welcome Anita Petagera. I hope I said that right. Oh, wait, nope, I forgot to tell you. I want to tell you that Dr. Chan lives in the area and he has 2 kids in college. Now to Miss Anita. Anita is a nurse and has been for over 40 years. She started her career in the emergency room and intensive care at St. Rose Hospital in Hayward. In 1990, Anita transitioned to occupational health. She joined Valley Care Health System in 1997 as the manager of employee health and occupational health services. In 2017, her duties expanded to include managing of both Stanford Healthcare Valley Care's urgent care centers or locations. Most recently, Anita has served on Stanford Healthcare Valley Care's leadership team, managing the organization's efforts around COVID-19, including testing and vaccines, which you guys are doing an awesome job on that. Anita lives in the area, in the East Bay, and she has 3 grown kids, and she has the best title of all, which is Grandma. Welcome, Dr. Chan and Miss Anita Petagera. I'm sure you, is she there?
I'm here.
Okay, there you are. Welcome, and we look forward to hearing from you.
Thank you.
Thank you. I'll go ahead and share my screen or share my presentation. Can everybody see that?
Yes.
Okay. So yeah, thank you. Thanks for having us. And I know the COVID pandemic has undoubtedly taken over our lives over the past year. It's been a very long road. And although we're not completely out of the woods, we're really excited that we're at least at the point where we can think about having our employees return to the workplace. That said, the situation is fluid and highly dependent on a number of factors, including your particular industry, as well as your local county public health requirements. These guidelines are changing constantly, and sometimes the guidance from the CDC doesn't fully align with state and county guidelines. And in those cases, at least here at Stanford Valley Care, we, as a general rule, we align with the county recommendations. One of the best ways we think to mitigate employee concerns about returning to work during the COVID pandemic is to have a well thought out worksite specific protection plan. Alameda County Public Health actually provides an excellent template that employers can use to develop their own plan. And I'll put that link in the chat in case you're interested. So items that need to be considered for returning to work as part of this plan include assessing your risk, your particular risk for your workplace and individual job duties, cleaning and disinfecting and hygiene, social distancing, face coverings, symptom screening, and then isolation, quarantine, and return to work guidelines. So I'll also talk about testing, travel, and vaccinations towards the end of the presentation. So when doing risk assessment, this is the when, where, and how workers are likely to be exposed. It's in doing that process, hopefully what will come out of it is the kind of controls or personal protective equipment that are needed for their specific duties. And it's also important to consider exposure for members of the public as well as coworkers. For example, in our clinic, the greatest exposure for our front office staff is at patient registration and at front door screening. So when those people coming in, using protective barriers, face coverings, and appropriate signage helps to reduce that risk. With cleaning and disinfecting, obviously having ready access to hand washing or hand sanitizing is important. Hand sanitizer should contain 60% of alcohol. And then you want to identify high traffic areas and surfaces that are shared or frequently touched that would benefit from enhanced cleaning. There was some questions when we were preparing the presentation about shared bathrooms. CDC, there's no, that's fine to have shared bathrooms, but CDC does recommend that these be cleaned regularly with products from EPA's List N. And again, I'll provide a link to the EPA site that lists these approved products in the chat later on. It might also be a good idea to limit the number of people using these shared bathrooms during the day with appropriate signage. Another question that came up was the use of HEPA filters. And while I think it's most important to ensure that ventilation systems are properly operating in order to increase the circulation of outdoor air as much as possible, you can consider using HEPA filters in certain areas, although it's not a requirement. While they don't bring in outside air for dilution, they can filter out the air and decrease the amount of concentrated airborne viruses. So areas where a HEPA filter might be useful are say, in health clinics, vaccination clinics, or other places like workout rooms or public waiting areas that may benefit from those. So what if an employee was at work who had COVID? You don't necessarily need to shut down the facility, but you may want to close off the area that was heavily used by that individual. The CDC does recommend that you wait 24 hours, if possible, before cleaning and disinfecting. This is to decrease potential exposure to airborne particles. But if waiting 24 hours is not possible, then it's recommended you wait as long as possible before doing the cleaning.
Okay, I'm going to talk about social distancing, and that is the practice for maximizing and maintaining distance of 6 feet between people. As you can see in this slide in the picture, we have, this is a picture of our front desk at our clinic. We have a plastic barrier up as well as marks on the floor. So that signage you want to be able to post signs, so that people know what 6 feet looks like on the floor. You want to modify seating or workstations or furniture, and then put up the physical barriers to try to promote this distancing in between your employees or customers coming in to your building. Next slide. Face coverings. So the Department of Public Health mandates the use of face coverings whenever outside of the home. I'm sure everybody's familiar with that. Face coverings are a measure to contain respiratory droplets and help to protect others, not necessarily protecting you, but do protect other people. And it does not replace the need for social distancing. So you still need to social distance, wear your mask. The masks should be cleaned every day, washed and dried before every use, or if disposable, they're single use. Next slide. Symptom screening is another important measure that you can take prior to employees coming back to work and every day, which is, employees should be asked to evaluate themselves for any signs or symptoms of COVID before coming to work. Anyone with symptoms should not come to work, or they should be sent home. I think some employees are very concerned about maybe trying to come to work when they have mild symptoms. And I can tell you from experience, sometimes COVID symptoms are extremely mild. People think that they're allergies, or I just had a little runny nose, it's gone now. So the symptoms of COVID aren't necessarily all of these that are listed: fever, cough, shortness of breath, fatigue, muscle, body aches, headaches. One of the ones that we see frequently is the loss of taste or smell, a sore throat, congestion, nausea, vomiting, diarrhea. So it could be one of these or all of them, and they can be very mild. So it's important to encourage your team members to not come to work if sick, and to let you know if they have any of these symptoms in the middle of the day, so that they can be sent home. Next slide.
As you know, we're coming up on allergy season, and although it seems like it's all year round here in the Tri-Valley area, but there's a lot of the allergy symptoms are common to COVID symptoms. There is a significant overlap, and this chart on here I thought was excellent at showing the overlap of some of the allergy symptoms that are shared with COVID. Our approach has been to take into account individual factors such as timing, and for that individual, if someone is having regular, allergy symptoms and they present with those same symptoms, in the absence of any known exposure, I wouldn't necessarily push to have that person tested for COVID. However, if those symptoms are new, they haven't had them in a while, or they're getting worse despite their usual allergy treatment, my recommendation would be to have them stay at home and evaluated by their PCP for COVID. So things that are not common for allergies are things like fever, loss of taste or smell, nausea, vomiting, and diarrhea, muscle and body aches. So anybody presenting with those symptoms, even if they have allergy symptoms, they should be ruled out for COVID. So I'm sure everyone hears a lot about quarantining, at home based on individual circumstances. However, the Public Health Department actually uses two terms, isolation and quarantine, and they mean two very different things, and it's important to know the definition. Isolation is keeping someone who is actually infected with COVID, whether they're sick or asymptomatic, away from others. And quarantining keeps someone who may have been exposed to the virus, but does not have COVID, away from others. An example of this would be someone that lives with someone that has been found or that develops COVID and is homesick. The reason why it's important to know the definitions of these, because return to work based if you were isolated or quarantined is different. So the CDC and the Alameda County Public Health Department says that someone that was isolated for COVID, meaning that they tested positive, can leave isolation 10 days after their symptoms first started. Now, if they were asymptomatic this whole time, then they can leave isolation 10 days after they got tested. In addition, they need to be 24 hours without any fever. And if they did have symptoms, they need to be significantly improved. They do not need to have a negative test for returning back to work. And the CDC does not recommend that people that have tested positive for COVID get retested unless any new symptoms develop. Employers should not require anybody, any sick employees to provide a COVID test result before returning to work, nor should they require a healthcare provider's note to validate that they had COVID in order for them to come back to work or to qualify for any sick leave. For those that have been quarantined, meaning that they were just exposed to somebody that had or has COVID, the CDC and the Alameda County Public Health Department says that these individuals can leave quarantine as long as they're not in any regular close contact with that individual, with an individual at high risk for a severe disease, and they remain asymptomatic 10 days after their last exposure, but that they should continue to monitor for symptoms for the full 14 days. The incubation period for developing symptoms of COVID is anywhere between 2 to 14 days. Now with vaccinations, who does not need to quarantine according to the CDC, and Alameda County Public Health recently aligned with this, is those that have been vaccinated and that have completed their 2 doses of vaccines for the Moderna and the Pfizer vaccine, and 2 weeks after their Johnson & Johnson vaccine, or they have had COVID within the past 90 days and they remain asymptomatic. These individuals do not have to quarantine. So what if you have an employee that calls in saying that they tested positive, or they were sick at work and later call in and say they tested positive? How do you evaluate the exposure, this exposure? What do you do about notifying other employees? First, if anybody is at work and with symptoms or develop symptoms, they should be separated from all other workers and sent home. With any employee that was confirmed to be positive for COVID, employees should be notified within 24 hours of a potential exposure. And employers should investigate the exposure and address any hazards. So if any employees that were found to be exposed to this individual, testing should be offered to the employee that was potentially exposed. And then return to work criteria for isolation and quarantine that we just discussed should be followed.
So close contact means that you've worked closely with that individual within 6 feet of a COVID positive individual for at least 15 minutes or longer, even if you're both are wearing masks. Some high risk activity that we have seen is break rooms. Typically are high risk if they're overcrowded and people can't socially distance 6 feet because people take off their masks, they eat and drink, and then you can be exposed that way. Also carpooling, we know that team members will go to lunch with each other, typically take off their mask, and the car is a closed, contained environment, and you can easily be exposed to someone who's, a COVID virus in the car. We do recommend that you don't bring in food from the outside. I know a lot of people like to have potlucks, celebrations. You shouldn't be sharing any food in the break room. Everything should be individually packed. And you should try to avoid direct physical contact with a person, hugging or kissing them. Obviously sharing food, eating, drinking, using utensils. If they sneeze, cough, or somehow get respiratory droplets on you, that's a close contact.
Now, I realize the number of positive COVID cases have been significantly decreasing in the county and statewide. Our experience has been that most of the positive cases that we have been seeing have been from home exposures, people that live with other people that have been positive in the household.
And then they come to work, and I think that we get very comfortable with our team. It's our family away from home, and we sometimes let down our guard with people we work with because we see them every day. It's just like our family.
And this might become even more confusing now that the CDC has recently put out new guidance regarding who you can be around without masks if you've been vaccinated. So I expect we may still see a number of cohabitation type exposures coming through our office. A little bit about testing. There are currently 2 viral tests that can be done. One is a nucleic acid test or an antigen test. These tests will tell you if you have a current infection. The PCR test is the one that you commonly hear. This is typically thought to be more accurate, if you will, than the antigen test. And this is the test that we use here at the hospital. There's also antibody testing. However, this testing only tells you if you have been previously infected with the virus. It does not tell you if you have a current infection, and should not be used to determine whether anybody can be cleared to come back to work. We recommend that anybody that has current COVID symptoms should be tested, regardless if they've had a vaccination or regardless if they've had the disease in the past. With travel opening up more and more people getting vaccinated, the CDC and the Alameda County Public Health still advise against any essential travel outside 120 miles. Anybody that has traveled out of state or outside of that 120 miles, they recommend that they quarantine at home for 10 days. I'm sorry, if 10 days would be for out of state or international travel. If they traveled outside the 120-mile radius and within the state, then they recommend that they stay home for 7 days and that they get tested from 3 to 7 days after they return from their travel. So vaccinations, wearing masks and social distancing have not been enough. And with vaccinations, we're hoping this can get us over the finish line to herd immunity. Currently, there's 3 vaccines that have been approved for use. 2 two-shot vaccines, Pfizer and Moderna, and 1 single-shot vaccine from Johnson & Johnson. For the most part, the only contraindication to getting a vaccination is if you've had an anaphylactic reaction to a component in the vaccine itself. Otherwise, there are no other absolute contraindications that we're aware of from getting these vaccines. Of course, if anybody does have a pre-existing immunological disorder or a medical condition or previous reactions, not necessarily anaphylactic in the past to other vaccines, then it's recommended that they talk with their physician before getting the vaccine. We've given quite a few vaccines here at Stanford and through Alameda Fairgrounds. I can tell you the number of people that are having complications or side effects from the vaccine have been relatively low. Most of the side effects were very mild, consisting of maybe low-grade fever, chills, fatigue, and muscle aches. The most common side effect was pain at the injection site. So you are considered fully vaccinated from these vaccines. I forgot a number 2 in there, but 2 weeks from your second dose for the 2-shot vaccines, and 2 weeks from the Johnson & Johnson vaccine from your first dose there. And I think it's important to realize that you cannot get COVID from these vaccines. So they are not live vaccines and therefore cannot cause COVID. So thank you. So we've touched on a number of things. We wanted to leave enough time for questions and to direct the conversation to where everybody wanted to take it. So thank you very much for your time.
Thank you.
It was in the last meeting.
I have a question. Can I jump in, Inga?
Yep, absolutely.
So if you don't mind, I don't know if you have access to those slides. If you could go back to my question is around once someone is vaccinated. So many of us are being vaccinated right now. So after someone has been vaccinated, it's my understanding that they are, what you just said is 2 weeks after their second vaccination, they are considered fully vaccinated. Does that mean that they can't catch COVID? Does it mean that they cannot, that they can or cannot infect others? I'd really like to know more about what getting the vaccination means.
Yeah, that's a good question. So all these vaccines during their clinical trials have been demonstrated to have a certain efficacy at preventing getting COVID illness. Pfizer and Moderna showed about a 95% rate of preventing getting COVID illness. Johnson & Johnson, I believe, was at, I want to say 76% or 66%. All the vaccines were close to 100% at preventing serious illness and hospitalization and death. So to answer your question, yes, it's still possible to get COVID, even though you've been fully vaccinated. And that's the case with all vaccines, even with, as we know, with our experience from the flu vaccine. Getting the flu vaccine doesn't necessarily guarantee that you won't get the flu, but it does, hopefully that if you do get COVID, it will be very mild and you'll recover quickly if you do have the vaccine.
So if you don't mind, if I can follow up on that. So if it's been more than 2 weeks after my second shot, and I become aware that I've been exposed to someone who has COVID, who currently has COVID, right? What is the protocol for what should I be doing then?
So if you've been fully vaccinated and you were exposed to someone that had COVID, the CDC says you do not have to quarantine. However, you should still continue to symptom monitor. And if you do develop symptoms, you should isolate yourself and you should get tested. The likelihood, the chance that you will get COVID is significantly decreased. And that is the basis for allowing people to not have to quarantine and to even be around other individuals in the same household without masks because of that reduced risk.
And if I
Okay.
may add, I think the risk is to other people who haven't been vaccinated. If you, even though you've been vaccinated and your risk is low, you can pass it on to someone who is immune compromised or has not been vaccinated yet, and then that could be significant.
Yeah, that's a good point. We still do not have enough data to say that those that have gotten the vaccine cannot transmit COVID. So although it may protect you from getting serious illness, it may not necessarily prevent the transmission of the virus to other people.
Okay.
I have a question. Wall Street Journal says you should or expect 2 to 5 weeks after the second vaccine before you're really out of the woods. Why the extra 5 weeks?
That's a good question. I don't know if, I don't know. I don't know the answer to that.
Okay.
Generally, the accepted number is 2 weeks. And I think after that, I think you can at least feel comfortable that you are fully vaccinated. So I don't know why. I haven't read that personally that, you need to do it for 5, you need to be careful for 5 weeks.
I haven't
But
heard that either.
I think in general, I think it's important to, even though you've been vaccinated, to continue to take, precautions with masking, social distancing, hand washing, and to, and that doesn't change that, that guideline or mandate.
Right. Thank you.
There was something in the chat about if you have employees that have been vaccinated, should we still be having them do a symptom survey daily before coming to work, from Katie? Yes, I believe if that's something that you're doing as part of your symptom screening, I would still have them do that, absolutely.
My question is, should we be doing a temperature check? For instance, if we do open to the public at some point, how do we monitor that?
Yeah, so I'll answer that. No, temperature checks aren't required anymore. And just from my experience, very rarely did somebody come to work who had a high fever, and we found out they had COVID. Most of the symptoms, I think fever is probably lowest on the list. So I don't think it's very helpful to check people's temperature, and not required.
But to do some sort of way to contact trace still, have them, is that an important piece as well still?
Yeah, contact tracing is important. If you have an employee or someone that you're notified has COVID, it's important to get that information, figure out who came in close contact without a mask, or even with a mask within the 6 feet over the 15 minutes. It's important to gather that information and then seek expert consultation on what you should do as far as employees and notifying them.
Okay.
So to clarify, to follow up on that, we have 2 sets of personnel. One are the staff, the employees that come every day. The other is members of the public that come and go. And it's harder, of course, to trace and to keep up with the members of the public that come and go. And so I'm looking for some help on what we should, other than the shields and using masks. Are there other things that we should be doing that you can think of?
Dr. Chan, you want to answer?
So with regards to with regards to your employees, the shields and the masks, we are constantly having to reinforce, with our own employees here. We do that through daily huddles. We do that through daily communications, and constantly having to remind them to maintain social distancing, hand washing, and all of that. So I don't think you can communicate and educate too much. I think signage, I think communication, whether that be through email or you have daily, morning meetings or however you do that, I think it's important to do that. It's important to encourage any employees that have symptoms no matter how mild, no matter if they think it's allergies or they think it's, no, I didn't think anything of it, that they need to report that, or they need to stay home if they have that. You know, we find that to be one of our biggest challenges is employees that are at work and that later test positive and find out, oh, they had some mild symptoms 5 to 7 days ago and didn't tell us. So, you know, really, I think employee education, I think, is very important. I don't know what your break room or lunchroom policies are. I don't know what your, but certainly addressing those and preventing people from gathering or making it more difficult for them to gathering can certainly help as well.
And for the public, I think just having signs, you know, that post symptoms of COVID, and that, you know, what to do, you know, they shouldn't enter the building if they have any of these symptoms. And then also your social distancing, your masking. If your team members are spending a long time with the community, make sure that they can do it in a safe way with either barriers, social distancing, because that will decrease their exposure.
Question. You mentioned not letting an employee return to work until their symptoms have significantly improved. The one that came to mind for me was the loss of taste and smell. That seems to linger the longest, and for some people it may never come back. Is it all symptoms, or are there certain symptoms that have to be improved? I mean, what do you do about that one?
Yeah, that I don't think it's all symptoms. I agree with you. The loss of taste or smell is not as concerning. The symptoms I would be most worried about are coughing, anything that generates, you know, airborne particles or something like that. Certainly, if they're still having fevers or they're still having, you know, nausea, diarrhea, or vomiting, I don't think they should be allowed back to work. But if what they're having are mild symptoms, maybe some mild fatigue, maybe still have the loss of taste or smell, maybe some mild headaches, I don't see a problem with allowing them back to work as long as they've met all the criteria for isolation and quarantine.
Which is past the 10 days.
Right. Now, the other thing I want to mention on that is with the 10 days, sometimes there's some confusion. And when does the 10 days start? So the date that you are either your symptoms started or you test positive is day 0. So really you can come back to work on day 11 after you've completed 10 days of quarantine. So that's, you know, counting that often is
yeah, and the infectious period can start 2 days prior to that. So 2 days prior to developing symptoms or testing positive is where you want to go back. If someone tests positive, you go back 2 days, and whoever came in contact with that individual 2 days prior to either symptoms developing or they test positive, those are the people that you need to worry about that came in contact with that individual, close contact.
Question on that, because if you go get your COVID test, say today, which is Wednesday, you don't get your results until Friday or Saturday, but today is day 0.
Correct.
correct. That's
Okay.
correct. Right. And if they come back positive, then actually you would, to Anita's excellent point there, you actually would need to go back to Monday. What was today? To Tuesday, right? Because even though they get the result back 3 days later, you go 2 days prior to day 0 is when you need to evaluate for any potential exposures at your workplace.
So day 0 is really test day,
Test day or
not results day.
correct.
Right.
Or
symptom
symptom.
start day.
Yeah.
So if they started having symptoms on Monday, but didn't get tested until today, their day 0 would be Monday.
But for quarantining, that shortens their quarantine period from the date.
That's okay.
Well, it does, but quarantine is actually 10 days from the date of symptom onset,
Oh, okay.
or if they were asymptomatic from the date of their test.
Okay.
So, yeah, patients are thought according to the studies, the patients were most infectious 1 to 2 days before their symptoms started. So we assume that if they are having symptoms, that they are at the height of their infectivity. And so it's even whether they test or not. And so if they're symptomatic and we test them, and that test came back positive, we can feel pretty confident that that's a true positive test because their viral load will be the highest during that time.
Just to clarify, it's not just 2 days, but it's 2 days and 1 day before there's nothing magical about 48 hours, right? It's a span of 24 to 48 kind of a thing, right? So if I am symptomatic today, then it's not only today, but it's yesterday and the day before, not just 2 days before, right?
That's correct. Yeah. And sometimes it's challenging because sometimes their symptoms are very vague and mild, and they may say, "Oh, I just had a runny nose that I thought was allergies," and then 2 days later develop a sore throat, and then suddenly lose their taste and smell. So really, I would go by when their symptoms started, when their true symptoms started. And sometimes it's very hard to go back and find really when they started to have symptoms. So in general, we err on the side of being conservative and overestimating rather than underestimating. But that can be challenging sometimes.
Did the question in the chat get answered? Yes. Okay. Never mind. Do we have any other questions? Clarifications?
Yeah, this is Dave Peters from Dublin, San Ramon. Can you hear me?
Yes.
Okay, yeah, I got a wavy internet connection. So my question is, we've got all these standards in place and we've been practicing them for quite a while. We have symptom tracker that we do online every day, and we have a COVID contact tracing thing. But my question is like the school districts, the CDC is recommending that they reduce the distances down to 2 to 3 feet or something like that. I think it's 3 feet now. Is that anything like that going to go on for the general public as we get closer to the end of this COVID thing, or is it going to be all and nothing? Like all these programs and procedures are in place now, and then they'll just go away, or are they going to taper off?
Well, to address the 3 feet, social distancing was specifically for elementary school students.
Right.
Actually, high school students is 6 feet. So the reasoning is because the high school students and adults are more likely to spread the virus than younger kids. So they felt that 3 feet was sufficient for elementary school students. I don't see that changing for adults and high school students going to 3 feet. And I think as we've seen with the CDC changing their recommendations on not having to mask, if you've been vaccinated, my guess is it'll just go to you don't have to social distance, but I don't see that anytime soon. Does that answer your question?
Certainly did. Thank you.
How long do you think this is going to be going on for COVID protocols? Do you think this is just going to be forevermore, or do you think it'll taper off and people will start to relax and not have the barriers and wearing the masks and all of that? How long does that usually take?
Boy, that's a good question.
Magic question.
It's the $1 million question.
I guess it depends where you are, right? If you're in Miami or if you're sooner rather than later. But there is concern regarding these variants that you've been hearing about in the news. There is concern that for another surge based on these variants, and that we're not quite at a point where we have enough people vaccinated to prevent another surge. So I think it's important that everyone continue to keep socially distancing, wearing masks, until we get to that point. So, that said, a lot of it also is dependent on whether we get enough vaccine. And while they keep lowering the, changing the who can get the vaccine, I just saw a tweet this morning that Governor Newsom said on April 15th, anyone over 16 is now going to be eligible for the vaccine. So, but the question remains, well, that's great, but are we going to have enough vaccine?
Right.
So, I think if President Biden reaches his goal of I think he was going to change it to 200 million people vaccinated. I think the more people we get vaccinated, the faster we can get to some sense of a normalcy. But my personal opinion is that we'll always have some of these measures in place, such as, at least for us in the hospital, I think we'll have more stringent masking requirements than we did before the pandemic. And I don't think that will change. And I think there'll always be some social distancing guidelines out there, whether they're strictly enforced or not, I don't know. So in short, I think there will always be some of these precautions in place, but I don't think they'll all go away.
Well, some of them seem rather routine, even during flu season.
Right.
What about in-person events? What do you think? Your crystal ball.
Oh, I don't even know where to begin on that. I don't know. If you're asking me if it'll happen this year, I don't think so. But
Me neither.
I mean, I'm hoping. I personally am hoping that all the colleges can open so my kids can go back to school in the fall.
Trust me, we feel the same way.
Yeah, adult children at home.
Right. We were supposed to be empty nesters, but that didn't happen.
This is Steve from the Pleasanton Chamber. Sorry I joined late. This may have been asked, but my concern, and I think some of our members, is okay. Let's say your staff, you have 5 people. I'm using my chamber as an example, and everybody's been vaccinated, but some of the staff still have concerns, right? Coming in, working, we're 6 feet apart, we're wearing masks. I mean, any advice on what to tell our employees so they're more comfortable coming back to work, even though I know that's a ways off. I mean, the orange tier, I understand, may be coming into play next week in Alameda County. 25% of the employees can come back. So any thoughts about how to communicate to our teams that, hey, it's very unlikely that you'll get COVID with vaccinations, masks, and then washing the stuff you're talking about. So is there anything else you can think of?
I think, for us, I think the thing that, as I mentioned in the very beginning, having a well thought out, plan on hygiene, cleaning, what you're going to do if someone's positive, and all of that, I think would help make employees feel more comfortable about being there. Even though I would encourage everybody to get the vaccine. I think certainly having people vaccinated and everyone around you is vaccinated would give some level of confidence to employees being in that environment. But again, I think, encouraging that social distancing, wearing the masks. And I think if, again, having prompt response to anything that does occur, like if someone says, oh, they're positive and someone was positive, having a quick response to that and a comprehensive response, I think could be reassuring.
Just open communication, communicate your plan, communicate what you're doing to keep your employees safe, and allowing an open dialogue so that people can tell you what their concerns are, and just, addressing it frequently, I think is important.
Great, thank you.
What if you have somebody who's, you're open communication, but they're fearful on unfounded or things that aren't you know what I'm trying to say?
Yes.
Yeah.
Microchip? Is that what you're trying to say?
Pardon?
Microchip.
Microchip. Yeah. Because I had one member who had COVID in their office, and he said it was like rats jumping off a ship. Everybody just went and left, and no one would come back until he did a full sanitation like it was a hospital for his office.
Yeah.
And it's like there's a misconnect between what is reasonable and what people want. It's like we underestimate our ability to get it and overestimate our death rate from it. Does that make sense?
Absolutely.
Yeah.
Well, I think, all the recommendations that we talked about today are come from the CDC, come from Alameda County Public Health. And so these are recommendations that are founded in science. They're not based on, they're based on the best information, scientific information that we have, at the time. So no, I get what you're saying. And I think, we are a resource to you as well. I think being able to provide your employees with an occupational health resource that they can call and talk confidentially to about any personal health concerns that they might have is another thing that you can do to build confidence among the employees that, that you're partnering with, an occupational medicine
Clinic. Yeah.
clinic. Yeah.
You offer some counseling.
Yeah, that's part of his degree. Did you not know that?
Do you have a phone number, or how do we reach your department? And do we need to have, does our employees have to have insurance, or is that something kind of outside of insurance?
Yeah, I think it's important that employers and leadership give us a call, set up an account with us, which just requires contact information, phone number. We can give you all our address, contact information. So you can call my direct line. I'll give you that number if you'd like to talk about an account or having us, help with your employees and your return to work. My number, do you want me to give it now, or I could put it in the chat when Dr. Chan adds his you were going to add that link for people for the Alameda County.
Yes.
So we'll add my phone number for you.
Okay, and people know how to download the chat if you want to. You just open the chat button and hit those little 3 dots on the lower right. And I believe you can save the chat right there. So after you guys put it in there.
Perfect.
Can I ask one more question about being at work? Does your team wear masks all the time, even when they're in their offices by themselves, or only when they're out and about?
So you can, we don't wear masks. We wear masks all the time. If we're going to be in our office and nobody's going to be coming in, we can take off our mask. But if people are coming and going, we need to leave our mask on at all times, except for when we're eating in the break room.
All right, thanks.
Do you have to mask if you're in your own private office with the door shut?
No, like I'm in my office right now and I have the door shut and I have a sign on my door that says, don't come in right now. And then once I get off this presentation, I'll put my mask back on, open my door. So I think as long as you can shut your door and nobody's coming in and out, you can take your mask off.
I would imagine if you're in a cubicle, which is much more open, that may not be the same case though, right?
Yeah, no, cubicle, you should leave your mask on at all times.
Thank you.
You're welcome.
Yeah, if you are in your car by your, driving alone, you don't need to wear a mask, obviously. And
this has been really, really helpful. Thank you both.
Yes.
You're
This is
very
great.
welcome.
Yep. And there's the link in there from Dr. Chan and that looks like the site specific plan, the Appendix A from Alameda County.
yes,
That's something now that we're probably moving to Orange, and you can bring back employees. You need to have a site specific plan.
That's
for
correct.
your office.
That's right.
Do you offer guidance on how to fill that out or how to figure it out, or can you tell us about somebody that can offer guidance or answer questions? Or is it pretty straightforward?
I think, obviously if you have some specific questions, you can call us, but I think it's pretty straightforward.
Okay. Okay. And then Anita, you put your phone number there, the 479-3700.
Yeah, I think that's the front desk. Dr. Chan gave that to you, and you can reach me through that number or
Okay.
Dr. Chan through that number.
Okay. Wonderful. Well, this has been amazingly informative, and I think very important. We recorded this, so we can share the information with other people who may have questions as the time goes forward. Don't forget to download that chat under Save Chat so you can capture that information, or call the office to, and we'll be happy to share it with you. Thank you, Dr. Chan and Miss Anita. I know I'm going to butcher your last name.
Okay. Can I just add one more thing?
Yes.
Often I'm asked which vaccine is the best vaccine, and I'd like to encourage everyone to get vaccinated so that we can get, some relief from this pandemic. But the best vaccine is the first vaccine you can get in your arm.
Excellent. Excellent advice. The Dublin Chamber is here to serve our members, and hopefully this is something that we have found extremely informative to help us reopen. Our next event will be Friday, April 23rd. We have Dr. Moss in a joint event with Livermore and Pleasanton Chamber, and that will be at 9:30 in the morning, and you can have your questions answered directly by the health officer. So anyway, I'd like to thank everybody for attending today. I appreciate your time. If there aren't any other questions left, then we shall sign off.
Thank
That's
you.
it.
Thank you, everyone.
Thank you again. Take care. Bye-bye.
Thank you.